I was voicing some of the concerns of the members of our caucus regarding the Medicaid expansion, which is probably the largest expansion of health care ever done in the United States and in the state of Illinois. So we have a lot of concerns regarding that expansion, especially because of the uncertainty of how many people are going to go into that expansion. The Department of Health Care and Family Services has said it would probably be around 325,000, but the Kaiser Foundation has said that it would probably be more like 500,000 in the new group, and it would probably be 180 to 200,000 in what they're calling the woodwork group. So what we're actually talking about is probably an expansion of at least 700,000 people onto our Medicaid rolls, of which we already have 2.7 million in the state of Illinois right now. In our local DHS offices, we have 2,500 clients to each caseworker. So this expansion is really concerning because I don't know how our offices can really prepare for that. Besides that, it's the financial burden on the state. If we go forward with this amount of population right now, it will cost the state $1.5 billion over 3 years. But if the Obama administration decides to change the rate to a blended rate after the first 3 years, this could cost the state close to $6.5 billion. That is not a good amount of money in a state that's on such bad fiscal footing right now. So those are some of our concerns. Paul Volcker, who headed up the SEC for years, who probably knows more about the federal government and finances than anybody in the United States, has recommended to all states not to move forward with the Medicaid expansion, especially at this time, because they think in the debt ceiling talks this September that there will probably be changes to that blended rate. So those are some of our concerns, which are very, very serious at this time, especially being that we have $9 billion of unpaid bills and probably close to $1.2 billion of new old bills in the 2013 budget, of which we don't know where we're going to pay those bills out of.